Hi everyone,
I'm Cole.
I'm Gustavo. Here start again today con Gustavo Sport Medicine Podcast.
So Gustavo, where are you from?
I'm from Spain.
Oh, so do you like soccer?
Of course, I love watching the Spanish national soccer team play.
So did you know that the famous Spanish national team player Gavi was injured in the match that took place on November 21st, 2023?
Yeah, right, anterior cruciate ligament tear, commonly known as an ACL tear, right? That was so bad.
Yes, that was so sad news. So in today's episode, we take a deep dive into young Spanish star Gavi's ACL tear, which is right anterior cruciate ligament tear. First, let's explain about the ACL. The anterior cruciate ligament, which runs diagonally anterior to the medial posterior aspect of the femur and attaches to the anterior aspect of the tibia. It is an important ligament that maintains stability of the knee, especially in controlling forward and backward motion and rotation.
An ACL tear, as the term describes, is a tear of the anterior cruciate ligament. In other words, when this is turning, knee stability is generally compromised, making it difficult to walk, run, and even jump or stop quickly. This is a serious injury that can be fatal for soccer players.
Let's talk about the main causes of ACL tears. This injury is especially common in sports such as soccer, basketball, and skiing. Major causes include sudden slowdown, change of direction, unnatural running from a jump, sudden stop, and impact to the knee from contact play.
For example, it can be caused by a strong force on the knee from contact with an opposing player during a soccer game or by twisting the knee when changing direction.
Take a look at actual Gavi injury moment. He first hurt his right knee on the contact by an opposing player. Here is a video of it.
Stunning Premier League draw against up on the right. Gavi looking for a free kick. I think you can have it with the referee's decision to give it. There will be concern for Luis de la Fuente and any followers of Barcelona here. Gavi down on the deck.
He was taken care of by the national doctor and continued to play. But when the chest trapped the ball, he strained the same spot and had to be replaced in the 26th minute. Here is a video of the incident.
And belted back with interest by Carvajal, and Gavi, who's back on the field, jests that his night is over. He knew straight away that it looks like a thigh injury or maybe the knee. Gets Georgia a corner.
The pain of his injury is evident in his expression.
The most likely cause in this case is that a minor tear had already occurred when he was initially contacted by the opposing player, and it can be determined that he forced himself to continue playing, and when his foot landed on his chest strap, the load was placed on the same spot and he tore it completely.
Since this happened only 6 minutes after contact was made, it's easy to consider the case. Everyone should not be forced to play.
Next, we will discuss the main symptoms of ACL tear. A pop sound may be felt when an injury occurs. You may also feel a sudden crumbling sensation in your knee. Severe knee pain, swelling of the knee, and instability or wobble in the knee are the main symptoms.
There are generally 3 grades of ACL tears, depending on the extent of the injury. Grade 1 is a minor injury, showing micro tearing and stretching of the ligaments. Grade 2 is a moderate injury with a partial tearing of the ligament. Grade 3 is a severe injury, complete tear of the ligament.
Next, we will discuss treatment and recovery from an ACL tear. The choice of treatment depends on factors such as age, activity level, and severity of injury. The RISE method is effective as soon as the tear occurs, and when the tear is minor, RISE stands for the rest. Icing, compression, and elevation. Early RISE treatment can help reduce internal bleeding, swelling, and pain, and aid in recovery. In adding to this, physical therapy can help minor tears heal. Physical therapy includes muscle strengthening, bending and stretching exercise, and maintaining range of motion of the knee.
Severe tears, such as Gavi's, usually require surgical ligament reconstruction, followed by rehabilitation. The surgery performed on Gavi was aimed at repairing the torn ACL. The surgery involved repairing the torn anterior cruciate ligament with a new ligament. Usually, the patient's own other tendons are used for reconstruction.
Currently, Gavi is in the rehabilitation phase. Post-rehabilitation is done in phase. The initial stage is to first perform knee flexion and extension exercises with the help of a physical therapist. It is painless. Ankle pumping exercises are also performed to promote blood flow and decrease the risk of blood clots.
In the intermediate stage, patients perform knee flexion and extension exercise on their own, as well as leg lifts and other muscle training exercise to improve the knee stability by training the nearby hamstrings and quadriceps muscles.
The later stages involve more advanced strength training, squats and lunge, and incorporate sport movements such as light jumps and steps. The final phase incorporates movement like actual play such as dribbling and shooting.
Finally, let's look at prevention methods. There are five major prevention methods. The first is to train the muscles. Perform exercise to train the muscles that support the knee, such as the quadriceps and hamstrings. It includes exercise to improve balance and stability. The second is stretching. Proper warm-up and stretching before exercise maintain muscles and joint flexibility and reduce stress on the knee.
The third is to improve technique. Learning the correct technique for correct movement, change of direction, and landing on jumps can reduce stress on the knee. Fourth is the use of appropriate equipment. Using shoes and supporters that fit your size will reduce the stress on your feet. Fifth, avoid extensive exercise. Extensive practice builds up tension in the body, and that tension can lead to a ACL tear. Be sure to follow the appropriate practice programs of your trainer or coach.
Gavi has been in rehab for about 6 months. He is currently working out and exercise in a gym, and his next major step will be running on grass. A full return is still expected to take some time, with the earliest return expected in the fall or winter of 2024.
I can wait for his return. He is still playing at the young age of 19. However, due to this injury, he will not be able to practice in the current Euro 2024 or the Summer Olympics.
Yeah, this is big blow to Spain. ACL tears are an unavoidable risk even for top player like Gavi.
That's right. I hope everyone will be on your guard and enjoy your support in life. Taking care to avoid such as ACL tear, ending today a Sport Medicine podcast. Thank you for listening.